Welcome back to the show. I now have with me dental hygienist Christine Clayton. Hello, Christine.
Hi.
It's lovely to have you on the show.
Likewise.
I've got a few questions, quite a few questions. I've got a few from our viewers as well. And obviously, I'm trying to think of questions that our viewers would also like to ask. But you've been a dental hygienist for how long now?
30 years.
30 years?
Yeah.
Are you serious?
Yeah.
I won't ask your age, but you do not look like old enough to be in dentistry for 30
yes,
years.
1983. I
Wow. Okay. Well,
yeah.
you look fantastic. We might have a beauty show next time and get Christine on to tell us her secrets about that. So tell us then, what are the most sort of common mistakes maybe that people make when it comes to caring for their oral health?
Generally, you find that patients tend to overbrush their teeth when they're brushing their teeth. They tend to cause gum recession and abrasion of the enamel, and that's due to either incorrect toothbrushing technique or lack of flossing, bacterial invasion and abrasivity, and a combination of all of those things. And that can cause the gums to recede. Once the gums recede, the teeth can become sensitive, and the sensitivity can be controlled by using desensitizing toothpaste, which do work these days. But generally, yeah,
that's the main thing. So what about it might be a bit obvious for some people, but others not. So what are the sort of the things that we should be doing every single day when it comes to caring for our teeth and gums?
Well, we ought to be brushing our teeth twice a day, every day. But we must also accept, in the mornings, we must also accept the fact that toothbrushing will not completely remove all plaque, or a lot of the plaque from your teeth and in between your teeth. So we need to combine the use of your toothbrushing with dental floss as well. It's very important to address the interproximal spaces as well as the insides and outsides and the top surfaces, the biting surfaces of the teeth. And often, sometimes a patient might think that perhaps if they just brush their teeth, they can press the bristles in between the teeth in order to access the interdental spaces.
And not bother with the flossing.
And not bother with the flossing. And then that can cause other problems in itself as well.
Who hasn't done that every now and then, trying to shove the brush between your teeth and try to get the stuff anyway?
And that can traumatise the gums as well. It can also make the gums recede.
We don't want to traumatise our gums.
No, but we do. We know, a bit lazy, and we think, well, if I brush a bit harder, then and also manual or electric toothbrushing as well. They might find that if they're brushing with a manual toothbrush, then they're not really brushing as effectively. Although you can brush effectively with a manual toothbrush, it's just a matter of manipulation, how you actually place the brush and what you do with your toothbrush.
Okay, now what about cleaning your tongue as well?
Yes, I think personally that's quite important to clean your tongue. There are different devices which you can purchase in order to achieve that. But I would have suggested that perhaps using your regular toothbrush to do that, brushing the tongue forward. So don't brush the tongue back and forth, because we have little filaments on the tongue, and if you brush them back and forward, it can actually cause the tongue to become sore and inflamed. So you can traumatise that biting the top surface of the tongue. So the best thing to do is to hold your toothbrush onto the tongue and just to simply and gently brush forward. You can get tongue scrapers to do the same thing. But
I've heard of those, but they sound painful.
Yeah, if you press too hard with them, they can be a little bit abrasive as well. But a toothbrush, a gentle toothbrush, using the side of the brush, not necessarily the bristles, to just brush forward, and that would normally do the job quite well.
I normally use an electric toothbrush, and I've got just a normal manual brush that I use to brush my tongue, but I always end up choking sometimes.
Don't go that far back. Don't.
I just want to get in there,
Yeah, that is tempting, but I wouldn't do that. Again, that can make the back of your tongue quite sore, because you do have other areas at the back of the tongue there which really ought not to be brushed, and also it can trigger off the gag reflex and can make you sick.
Yes.
So perhaps it's not a good idea to go quite that far back.
Okay, I shall change that. Now tell us now about, obviously one of the questions that we have from our viewers as well is about bad breath.
Yeah.
What we can do about bad breath. Everyone gets it from time to time, don't they? According to something you've eaten, or maybe you haven't eaten for a long time, and something people are very conscious of as well, and can even really disturb your social interaction and things like that. So what's the best thing to do to prevent bad breath?
Well, you can't really prevent bad breath completely, because I'm sure most of us know about morning breath, and let's not mention that.
No, you can't.
What is that?
We talk about everything on this show.
Yes, it can be controlled, and your diet certainly is a part of that, because you can get lots of odour retention from various things that we might consume on a daily basis. For example, garlic tends to not just come out through your oral odour, but also through your pores as well.
I knew that. I said that to someone. They didn't believe me.
Yes,
I said it comes out your pores when you could, because when someone's
yuck.
had garlic and they're sweating, you can smell it everywhere. It's like, it starts to sort of come out. Yeah, thank you for saying that on TV. I just can't remember who I was arguing about it with, but I shall try and find the person and say it was on TV.
Yeah. And so to control halitosis, the best thing to do, there are several things you can do in order to control halitosis, and the halitosis, by the way, is the term for bad breath.
It's the posh term.
The posh term. And what you can do is brushing using an electric toothbrush or a manual toothbrush, and it's effective toothbrushing. So there's a difference between brushing and effective toothbrushing. So you really do want to make sure that you're removing the plaque effectively, because plaque contains sulfur acids, and these they're called volatile sulfur acids, and these sulfur acids are the acids which actually cause that awful stench in your mouth. Okay, so we want to remove that effectively as possible by brushing well, and then you need to floss in between your teeth to take care of any plaque retention incidentally.
Should you floss before or after you brush?
You will need to floss after you've brushed your teeth. So when you brush your teeth first, you get rid of the bulk of the plaque by brushing with your toothbrush, and then the finer deposits are then removed by using your dental floss, which is less.
You're doing that the wrong way around sometimes.
Because if you floss first, you've got more plaque around your mouth for the dental floss to cope with, and its floss is only very small. So if you remove the majority of the plaque by effective toothbrushing, you can then go on to remove the finer deposits by using your dental floss.
Okay. And I've got to ask this question about teeth whitening. This has come through from Helen, and she's saying, how is it safe to do teeth whitening, and how often? This is something that I've wondered before. When I spoke to my dentist, he said to me, don't do it because it's not very good for your teeth. And then other people say, no, it's fine for your teeth. What would you say?
I've not heard of any contraindications having had your teeth whitened other than sensitivity. Right. So I'm not aware of that. We do teeth whitening all the time. In fact, I did one this morning, very successful. The patient was very happy with that. And your question was, how frequently can you have your teeth whitened? Well, there are three types of systems, really, three systems that you can have. You can either whiten your teeth by using the home whitening system, where the patient takes home a kit and they go home and they pop the loaded trays, pop the tray, pop the whitening gel into the trays, and then pop the loaded tray into the mouth and whiten their teeth per day for X number of days, according to what the dentist prescribes, or hygienist. And then you can have the power whitening or laser whitening, which gives you whitened teeth after 1 hour's treatment.
Oh, nice. That sounds good.
Yeah, that usually...
How long does that last?
About the same length of time. I think you get the same results with either or.
So how long are we talking about?
2 to 3 years at least.
Oh, really?
Yeah, it's now,
I thought it was something that you'd have to do every few months or so.
No, you can obviously whiten your teeth again, but it's not really advisable. We would advise that, in my opinion, I would advise that the patient has their teeth whitened using a combined system, which is a third option, where you'd start off with having your teeth, using the laser whitening system combined with the home whitening kit for a set period of time, usually about 6 days or so, or maybe a little bit longer, and then leaving that and not having your teeth whitened again for at least 2 or 3 years. Wow, if the patient then chooses to whiten their teeth further within that period of time, there's no harm in doing that either. So they can go ahead if they've got a wedding or a social event, they'd like to enhance the colour of their teeth. Just to enhance the colour, not to go totally Hollywood, as I call it, when it's too white. Then, of course, they can continue with that by using their home whitening kit for a further few more days as well, and that will just help to lift the colour of their teeth.
Okay, all right. Well, unfortunately, we've run out of time. We did have more questions, and I've just been told we've got a caller on the line as well, which I'm so sorry we can't take your call now because we have run out of time. But we'll take your question down during the break, and then Christine, we can maybe answer that on our Facebook page if that's okay.
That's great.
Thank you so much. You were great.
You're welcome.
And I'm really interested in teeth whitening now that I know it's safe to do.
Well, come and see me. I'll be happy to see you.
Okay. Okay, so then after the break, we're going to be speaking to Chris Brown with our self-development clinic. So do wait for us, and we're back after this.